RIN TV coverage of the 2015 RIMS conference is brought to you by Inform Applications. Certain workers' compensation issues pose a difficult problem for employers. On one hand, employers want injured workers to be healthy. On the other hand, there is the cost. And now there's a new class of disease to contend with, obesity. It all gets rather complicated. Here at the RIMS conference in New Orleans, we spoke with MaryRose Reaston about these and other developments in workers' comp. She is Chief Scientific Officer and founder of Emerge Diagnostics and had this to offer.
The three biggest issues related to workers' compensation claims today are really finding the way to only accept claims that arise out of the course and scope of employment, mandatory reporting with Medicare, and soft tissue injuries are on the rise for frequency and severity. The AMA reclassified obesity as a disease, and that's going to impact every workers' compensation claim as, for sake of a better term, an additional body part. It's going to be mandated under the Americans with Disabilities Act as an expanded class of a disease, so it's going to have severe financial implications on the employers, both on the workers' comp and federal level. Why are soft tissue injuries so difficult to diagnose and treat is, in the past, there's been no way to adequately diagnose soft tissue injuries. MRIs are not for soft tissue, they're for structure. So until the advent of the EFA, there's been no adequate test that can really impact soft tissue injuries. Every workers' compensation claim in every state, you're allowed to return the individual to pre-injury status. Well, what's pre-injury status without a baseline? So a baseline is really looking at somebody before the injury and after the injury to determine if there's a change in condition. And the EFA STM program is specifically designed to look at soft tissue injuries, one of the leading cost drivers, as a baseline program. The obstacles are different because baseline testing represents a paradigm shift in workers' compensation. It enables better care for the worker for the work-related condition. So it's kind of thinking outside of the box is the biggest obstacle. What lies ahead? What new developments in technology can affect these types of developments? Well, we don't know what the AMA is going to reclassify. Look at obesity, the reclassification of disease. Better diagnostics for soft tissue injuries are on the horizon, especially for wearable technologies and Emerge Diagnostics.
For more of our coverage of the 2015 RIMS conference in New Orleans, visit the RIN TV On Demand Library.